Hi, my name is Mark. I have been a patient of Dr. Oliak's for 18 months, and to date I've lost 87 pounds. I came to Dr. Oliak because he offered a full program that encompassed not only surgical weight loss, but follow-up as well as preoperative care. I chose the lap band operation simply because it offered me the restriction and the opportunity to have a more controlled weight loss as well as long-term success. The lap band gave me the ability to eat smaller portions by giving me restriction. I knew a physical barrier inside my body to have me stop eating was what was going to help me succeed. And knowing that I would take in a certain amount of food and be satisfied for a long period of time was the reason that I chose lap band operations. Losing weight with the lap band really was a lot easier than I was expecting. I was expecting pain associated with it. However, I found that so long as I followed the simple rules that were set forth, I was able to lose weight a lot easier than I was really expecting. The lap band gave me the opportunity to eat smaller meals. My getting up and moving and being part of the weight loss process was so important. When I eat socially, I tend to go for softer meals. Protein first, which is important, and I focus on my eating habits. I take my small bites. I use my small fork. I eat the smaller portion. And as I get through a meal, I know when I hit a point that I've had enough, I'll just push my food away and say thank you for the dinner. When it comes to the foods that I choose to eat now, there's really no restriction. It's what satisfies me. I've found that after having weight loss surgery that there are foods that I didn't like to eat before that I choose to eat now. The variety in the menu that I can have is pretty much unlimited. There's nothing that I've found that gives me any upset or causes me any distress when I eat, which is one of the things that I liked about the lap band, is it didn't change my anatomy to a point that it was going to cause me any sort of distress or have to focus me on a specific type of foods. This saved my life. I was on a slippery slope on my way down, and to this date, after 18 months, I'm no longer a type 2 diabetic. I no longer have high blood pressure. I eat to live. I don't live to eat. Would I do it again? Absolutely, in a minute. And I wholeheartedly, to people who talk to me about it, I suggest it highly. And I tell them that the process is you do half, the surgery will do the other half. The changes that I've been able to do since my weight loss have just been on a complete 180. Never did I exercise before. Now I exercise like crazy, and I love it. The mobility that I have. Before having weight loss surgery, I was uncomfortable sitting down, standing up, laying down. Clothes didn't fit me well. Now to go shopping to purchase new clothes is just an incredible. It's a lot of fun now because there's so many different choices. My mobility has increased. I'm not uncomfortable being where I am. Simple little things like crossing your legs were just those little successes that just made this so much more fun. Going to the tailor and having your clothes constantly taken in was just, it was expensive, but it was just fun to see my life changing like that. And the fact that I smile a lot more, I'm a lot happier. There's always the tone of the jolly fat man, but there's the jolly thinner man too.